Hello and welcome. You are watching Business Today. I'm Neetu Chandra Sharma. As diagnostics get smarter and digital health picks up pace, global medtech firms are stepping up their play in India. Technology company Philips is ramping up its presence with new investments in AI, innovation centers and public healthcare partnerships. To talk about where the company is headed and how it is reading the Indian market, I have with me on the show Bharath Sesha, Managing Director, Philips India Subcontinent. Thank you so much for joining us, Bharath. So I want to begin with asking you that what are the key innovation and R&D focus areas for Philips in India this year?
So thank you for the time, and it's always a pleasure to talk to you. In India, we have made significant investments in the last couple of years, mainly on innovation and manufacturing. The most recent ones being the innovation investment that we've made in the Global Innovation Center here in Bengaluru, where we have created an innovation center that innovates on AI, on software for the world. So this is a significant investment we have made where we are continuing to innovate and develop new products and new AI-related enhancements to healthcare devices. We also have announced that in the process of completing R&D center in Pune. Both of these together has been a commitment in the order of magnitude of 700 to 800 crores that Philips has made in the last couple of years. And the journey to strengthen our innovation capabilities, our R&D capabilities in India continues. And I always like to say that Philips doesn't just make in India, we also create in India for the world.
Okay, so if you can also share the scale of investments being made and how these funds will be allocated.
So as I said, we've made in the 800 crore magnitude of investments just in the last 2 to 3 years. I don't have a specific number for the future period, but directionally, we continue to strengthen our innovation and R&D capabilities in India, along with the fact that we have global manufacturing in Pune.
All right, so why is India a priority market for medtech firms like Philips and what makes it attractive right now?
So in the two businesses that we operate, in the health tech and the personal health space, both we are seeing transformative trends in India. And let me spend some time on the health tech business. As we all know, the healthcare challenge is a global challenge. Providing access to quality healthcare across the world is a challenge and an opportunity. The same is true for India. If you look at some of the trends that are there in India, I always say that we have world-class clinicians. We have world-class doctors in India. We have to support that amazingly strong capability and competency we have with adequate infrastructure when it comes to medical technology equipment that supports faster diagnosis, provides access to all parts of the country for having the capability to diagnose and treat timely and effectively. So this is basically a trend that you see across the country. And Philips is right at the forefront of making sure that we do all we can to bridge this gap that exists between the capability to provide world-class clinical outcomes to the infrastructure to be able to support that capability. And for us, the solution to that lies on two angles. One is, of course, strengthening and enhancing the footprint of medical tech equipment, which means more medical tech equipment, an MRI or a CT or a digital X-ray, all of this across the country. But equally important, and this is at the core of what we do in Bengaluru, equally important is to make sure our existing equipment, be it an MR or a CT or any other equipment, is able to be more efficient, is to scan more patients a day, is to be able to give the same high quality images with higher throughput. Now, our innovations, and a lot of them are already commercial and in India, are addressing this challenge of making sure that your existing infrastructure as a hospital, as a healthcare center, as a government hospital, is able to provide more access to more people. And that's kind of the two elements of the opportunity. And this drives a lot of the attention towards India as a healthcare market, because there is only one way this market is going to go, and that is significantly higher. And you can see that already happening in the service delivery space, and it is also starting to happen in the medical tech space. So I think this trend is very, very strong, gaining momentum, and will continue to increase and accelerate as we go forward.
So as we understand that your Pune facility supplies equipment to several countries, so what are the next steps in local manufacturing and how is the Make in India strategy being implemented by your company?
So Pune manufactures products that are exported to more than 100 countries. The products that we make in Pune, we make for the world. Also in Philips, all our global locations receive products that are made in Pune. This is an example of the commitment we have towards making India as an integral part of our global supply chain. We continue to evaluate our ultrasound capabilities, right? We continue to evaluate additional products that we could bring into India. For sure, in the future, India will, as I said already, will be a hub both for manufacturing, but also for innovation, R&D in software and AI. This journey continues. We will continue to strengthen our industrial footprint in India. We will continue to strengthen our innovation capabilities in India.
Can you also please explain for us that how is Philips integrating artificial intelligence into its healthcare portfolio and what kind of impact is it having on diagnosis and patient outcomes?
So I think this will become an integral part of this industry as we go forward. Philips is very proud to be at the forefront of making sure that our artificial intelligence innovations start with the patient in mind. It's very patient-centric. And I'll underpin it with a couple of examples. I just talked about the fact of we need to have more efficiency and throughput in a system. What is equally important is for us to drive that throughput or enhance that efficiency, we have to reduce the scanning time for a patient when they get into a machine. I am personally claustrophobic, so I don't like to spend a lot of time inside an MRI machine. But those type of challenges that a patient feels and experiences when they're already under trauma, I mean, it's not the most pleasant thing to be when you have to go for a scan. How can we reduce the time a patient spends in the machine? And that is something that we develop using AI. And it is all about making sure the positioning of the patient is done in an efficient and effective manner. And AI corrects for any faults or flaws that may be developed in a scan because of the positioning not being accurate. All of these small nuances, which comes from very clear understanding of patient priorities, patient centricity is at the core, are enabling us to develop these type of solutions. That is how AI will transform healthcare, is providing patient-centric innovations that make a patient's diagnosis more effective, efficient, and giving the clinician the information on time to be able to make the right treatment regime possible for a patient.
So with that, I also want to understand that what impact is the artificial intelligence having on disease detection and treatment outcomes, and how important do you think does the clinical judgment remain in this context?
So AI will always be complementing the human being when it comes to capability to diagnose. It can never replace. And at Philips, we always believe AI is a tool to enhance capabilities, not to replace any capabilities. AI is a tool to free up time of a clinician, a nurse, a caregiver to spend that time with a patient. It is never a tool to replace that caregiver or the clinician or the nurse. So AI is always a plus tool. It is not a minus tool. So it enhances, it never subtracts. And that's a core belief we have when we develop innovation. At the end of the day, the human judgment, the clinical expertise that is needed to make the final diagnosis should always be the case. AI will enhance that capability, will make that judgment, maybe giving different information, more quicker information, more holistic information, but can never be a substitute for this. And this is at the core of how we believe AI will work in the healthcare space and will continue to be at the center of how we develop innovations going forward.
So as you said that the company is integrating technology in its products and services. So your company is also expanding in tier 2, tier 3 cities. So if you can tell us that how are these products and pricing being tailored for smaller towns and private healthcare providers in these areas?
So nearly half our equipment currently is in tier 2, tier 3 cities as Philips in India. And that is coming from the fact we keenly understand that the challenges and the opportunities that a tier 2, tier 3 city, a doctor there or a hospital there faces is different. And we always make sure that we understand that and we are able to address that. Now, first thing that we always talk to when we talk to doctors or clinicians or hospitals in tier 2, tier 3 is scalability, because they will need a solution that is going to kind of be with them as they scale from, let's say, a 50-bed hospital to a 100-bed hospital. So any solution we offer them in terms of equipment must be a scalable solution. The second is also we support them on their growth journey by making sure that we are able to support their financing needs via our Philips capital arm. And last but not the least, you mentioned it yourself, the AI solutions. AI is very, very important where we don't have the right quantity or quality of people to read scans, right? And this is a challenge because you have attrition, which is higher in tier 2, tier 3 of clinicians and healthcare professionals. So wherever AI can help and support a doctor who has to now look at 5 scans an hour instead of 2 in some other places, these type of tools help the doctors there and our partners there to provide better care for more people. So our tier 2, tier 3 approach and go to market is very specific and tailored to the specific needs and challenges that is faced in these markets.
So, Bharath, let's talk about public-private partnership models as well. So, you have partnered with Indian government on digital health initiatives like health IDs, medical records and all. So, what is the scope of this partnership and what are the key outcomes that you are aiming for?
So I think we work with the government, and it's a very our visions are aligned. Arogya Bharat, Ayushman Bharat, the visions are aligned, and we work with them on multiple fronts. So, for example, we are a proud partner to many AIMS facilities across the country, and there we are always working with the doctors there in terms of how can we bring technology interventions to enhance the workflow through the hospital. Because as we all know, it's also about the ability to get more patients in through the hospital system in less time. So we work with them on making sure not just the flow within the equipment is faster. How can we work with them to make sure that everything around that can be more efficient? And that's a continuous journey. We're also our enterprise informatics solutions, which are still under discussion with many of the government institutions, also provides a synthesis of data that we get from various tests of the patient and provides a comprehensive and holistic view to a clinician to make a judgment based on a collection of data, not just one scan or one report. That's also an initiative we currently talk to about with many of our stakeholders in the government. And we continue to engage with the government. We continue to talk to them about how technology can be a purposeful intervention in our healthcare opportunity and challenges in India. And we're very, very pleased and proud that we continue to work with the government in a positive way. We're transforming healthcare in India.
We also want to understand that what are the focus areas of Philips going forward in India? How are you looking at the future growth with it be organic expansion or external collaborations? How is it going to be?
So we have a long way to go organically still, and we continue to focus on doing that. At this point in time, we don't have a specific strategy towards inorganic or partnership. However, as I said, the healthcare challenge has to be addressed with partnerships, meaningful partnerships. So that we do anyway with our customers, with clinical studies that we do with our customers, with institutions. So that will continue. There is no change in that approach. We will continue to do that. From a business perspective, we have a long way to go where we can still expand organically, and we'll continue to look at that as the a chosen avenue at this point in time for expanding. And that's also the focus. And I think it's also important for me to stress the footprint that Philips has in India, because this is also a very compelling journey that Philips has undergone in India. We all grew up with Philips. So Philips, I grew up with Philips. A lot of us did in India. And Philips has many, kind of avatars it's taken over a period of time before it's now come into this focus on personal health. We've now focused on personal health and health tech. However, the underlying philosophy behind the company, the underlying emotion it evokes is trust. It's about trusting what Philips brings. It's about trusting how Philips will address the challenges and opportunities. So I think that's the underlying theme. And with that trust built, not just with customers or consumers or patients, but also with employees. So we have now nearly 9,000 people in India. It's 12.5% of our global workforce. And we have footprint in innovation, in manufacturing, in knowledge process, in competence centers, and all of this, and of course, commercial. So I think this is the direction that you could see. It's always easy to talk about the future, but the past at the end of the day represents the future. So this direction that we have taken of strengthening our footprint, expanding our ecosystem, having more or less a microcosm of Philips in India, every business we have, every function we have is represented in India. Global R&D leaders are present in India. Global IT leaders are present in India. So it's really a commitment that we've made and we continue to make to India. And that is kind of the journey going forward, also from Philips's perspective.
Thank you, Bharath, for those valuable insights. That was Bharath Sesha, Managing Director, Philips India Subcontinent. While we follow what's more with Philips, stay tuned to Business Today for more conversations on healthcare innovation and business strategy.
If you like the video, do like, comment, share and subscribe.